Can Zepbound or Wegovy stop binges, not just lower weight? Both reduce appetite and may quiet food thoughts, but neither is approved for binge eating disorder. The best trial evidence from a related drug came from 27 adults taking liraglutide for 17 weeks. Binge episodes improved in both groups, but the drug did not clearly beat placebo. Established binge eating treatments still have stronger evidence. Wegovy contains semaglutide, while Zepbound contains Tirzepatide. Both strengthen gut hormone signals that tell the brain you have eaten enough. They reduce hunger and make smaller meals satisfying. They can also change cravings and the attention people give to food. Those effects could matter because binge eating disorder is not simply eating too much. A binge involves an unusually large amount of food and a feeling that control has disappeared. Episodes cause distress and usually occur at least once weekly for 3 months. Regular overeating without lost control is different. The key symptom is loss of control. Someone may eat rapidly, continue when uncomfortably full, hide the episode, and feel shame afterward. The disorder can occur at any body weight. Unlike bulimia, binge eating disorder is not regularly followed by vomiting, laxatives, fasting, or excessive exercise. A smaller appetite alone cannot remove every part of an eating disorder. Appetite is one driver, but stress, rigid dieting, reward-seeking, sleep loss, depression, and learned routines can also trigger episodes. A medicine can weaken hunger, while the emotional and behavioral triggers remain active. Patients often describe fewer persistent thoughts about food. Food may stop dominating attention between meals, and cravings may feel less urgent. For someone whose binges begin with relentless thoughts about food, that mental quiet can create room to choose a different response. Direct clinical evidence is much thinner than the appetite story suggests. 27 adults entered a 17-week trial of Saxenda, which contains liraglutide. Researchers assigned them by chance to daily liraglutide or an inactive placebo. Weekly confirmed binge episodes fell by about 4 with liraglutide and 2.5 with placebo. The difference was small enough that chance could explain it. At week 17, binge eating had stopped in 44% taking liraglutide and 36% taking placebo. The binge results showed no clear advantage for liraglutide. Participants taking liraglutide lost about 5.2% of body weight. The placebo group lost about 0.9%. Weight loss clearly favored liraglutide, unlike the binge result. The trial therefore provides stronger evidence for weight loss than for binge control. A separate clinic record review reported improvement with semaglutide. Researchers analyzed 48 patients with moderate or severe binge eating symptoms. 19 received semaglutide alone, 13 received semaglutide with other medicines, and 16 received other medicines without semaglutide. Because treatments were not assigned by chance, this study provided weaker evidence than the liraglutide trial. Scores on the binge eating scale, a symptom questionnaire, improved about 14 points with semaglutide alone and 12.9 with semaglutide combinations. The comparison group improved about 5.9 points. The result supports larger trials where treatments are assigned by chance. That study measured questionnaire scores rather than carefully counted binge episodes. Weight loss, nausea, or early fullness can also reduce how much someone eats during an episode. True recovery should also improve loss of control, distress, secrecy, and the pattern that drives repeated binges. A 2026 review found 12 human studies of gut hormone medicines and binge eating outcomes. Most samples contained fewer than 75 participants. Results generally moved toward less binge eating, but the studies used different patients, drugs, definitions, and measurements. The evidence base remains small and difficult to combine. Strong appetite suppression can also create a false appearance of recovery. Skipping meals or eating far too little can drive late-day hunger and another binge cycle. Real improvement means fewer food thoughts and fewer lost control episodes, while regular eating remains possible. Nausea that simply blocks food is a side effect, not recovery. A 2025 Nature Medicine report added a different kind of evidence. Researchers recorded activity from a brain reward area in one person taking Tirzepatide. Thoughts about food stayed quiet during months 2 through 4 after brain electrodes were implanted. The linked brain signal also stayed low. Later, food thoughts returned despite the maximum Tirzepatide dose, and the electrical signal returned too. The report involved one person with brain electrodes and no comparison group. It was not a binge eating disorder treatment trial. In that patient, food thoughts and one brain signal changed together. Because medication evidence remains limited, treatment still starts with a proper diagnosis. Cognitive behavioral therapy is a structured talk therapy that identifies triggers and reduces rigid food rules. It also builds regular eating patterns and new responses to urges. What matters is not how quickly the scale falls. Track binge days, loss of control, food thoughts, distress, secrecy, and whether meals remain regular. A useful treatment should improve several of these measures while preserving enough food and fluid intake for normal health. Improvement should remain visible after early nausea settles and during stressful days. Ask whether urges are less frequent, episodes are smaller, and control returns sooner. Those changes can appear before binge eating stops completely. They show that the eating disorder itself is moving in the right direction. Consider 2 patients who each lose 10 pounds. The first stops binging, eats 3 planned meals, and feels less shame. The second skips food all day, binges twice weekly, and hides the episodes. Their scale result matches, but their clinical result is completely different. When medication is needed, Wegovy contains a lisdexamfetamine and is approved in the United States for moderate to severe binge eating disorder in adults. It can reduce binge frequency. It is also a stimulant, with risks including insomnia, anxiety, increased heart rate, misuse, and addiction. Wegovy or Zepbound may be considered for weight management when binge eating disorder occurs with obesity. Both medicines are approved for chronic weight management in eligible adults. Reduced hunger may support binge treatment, while therapy can address triggers, routines, and loss of control directly. Using an appetite suppressant without confirming the eating problem is a poor reason to start treatment. Night eating, emotional eating, grazing, bulimia, and binge eating disorder are not interchangeable. A correct diagnosis determines what outcomes should be tracked and which treatment has the best evidence. Before treatment, review binge frequency, restrictive dieting, vomiting, laxative use, mood symptoms, and past eating disorders. During treatment, watch for meals becoming impossible or eating becoming severely restricted. Also watch for dehydration, repeated vomiting, or binges returning after early improvement. Dose increases should follow side effects and the condition being treated, not a race to silence every thought about food. Some hunger is normal. The goal is better control and health while keeping a stable eating pattern, not eliminating every thought about food. So can Wegovy or Zepbound treat binge eating. They may reduce hunger, food thoughts, and binge symptoms in some patients. The evidence base remains too small and inconsistent to establish either drug as a binge eating disorder treatment. Treatment aimed directly at binge eating disorder remains the foundation. Use the scale as one outcome, not the verdict. Count binge days, track whether control returns, keep meals regular, and use medication for a clear medical reason. When binge eating disorder is present, combine weight management with treatment that directly targets the disorder. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.